Good afternoon. My name is Dr. James Frame. I'm a physician and attorney practicing in the North Texas area. Today I want to talk to you about your opportunities as a paramedic. In the 1970s, the paramedic program throughout the country spread like wildfire after the television series Emergency premiered. It then became apparent to emergency medicine physicians and the healthcare community in general that emergency department services could be delivered on scene in a very rapid fashion. Fire departments traditionally took this role as they were the closest and already established, as far as stations and locations are concerned, to the general populace. Well, today that's continued in its trend. And throughout the country, fire departments staff themselves with all hazard, all response professional firefighters who are also paramedics and can provide any emergency type rescue, extrication, and life saving delivery of health care. Now, today, as we look forward into the 21st century, we see the role of the paramedic actually evolving. There are now ladder and career opportunities that are available for the paramedics, so your training need not stop there. One of the greatest examples that we have of paramedics furthering their careers is the so-called bridge program, where the paramedic bridges into a registered nurse program and becomes an actually licensed, certified, registered nurse. Most of these nurses take on ICU or emergency medicine roles. Many use it to augment their knowledge base. Others use it as opportunities to get into hospital or other healthcare entities and move forward with their careers in those paths. We also see paramedics evolving from registered nurse into mid-level providers, or what these traditionally called advanced nurse practitioner. These offer master's degree, or in some cases doctorate degrees, where the nurse practitioner is actually an independent practitioner, licensed, and can practice under their own license within a state. Subsequently, many of these nurse practitioners move into a private practice situation or augment a physician's office. For instance, internal medicine, general surgery, oncology, orthopedics, pediatrics, and including emergency medicine will utilize advanced nurse practitioners in these settings to take care of patients. They actually round in the hospitals, write orders on patients, initiate treatment plans, and of course, discharge patients. Moreover, in the emergency department, they're involved with seeing patients in the emergency department and actually performing life-saving skills and treatments for these patients. Now, it doesn't have to stop there. Many paramedics who become registered nurses, or many paramedics on their own, without going through the nursing pathway, can jump right to the physician assistant pathway. Now, many of these programs are sprouting up in the country, and they take the best of the best. It's the fourth fastest growing profession within the country. Physician assistant differs only slightly from the mid-level provider or the advanced nurse practitioner in what they can do, the techniques, the skills, and the training that they receive. Most of that is mostly physician-based or allopathic, osteopathic directed training. In the case of a nurse practitioner, there's a strong emphasis on holistic medicine and the role of the nurse practitioner taking on a more broader role, more comprehensive, and of course, more independent. Now, the physician assistant has been a great augmentation to physician practices, both in the emergency department as well as the clinical or office settings. Cardiologists, general surgeons, cardiovascular surgeons, and orthopedic surgeons have used the PAs not only in the office setting but in the operating room as well. Many times the physician assistant will either stay in the operating room the entire procedure, or they'll do the first 1 hour of prep on the patient so that when the physician surgeons arrive, they can go right into the actual procedure that needs to be done in the surgical suite. And then the physician assistant will then augment that physician and finish the case. These are the primary roles of physician assistant and nurse practitioners. Their training and their techniques and their skills have become interchangeable, and one thinks of them often as just under the category of a mid-level provider, yet their worth and the benefits to the healthcare system have been the single greatest impact in the 21st century than any other evolution of training. And it all starts because they were paramedics. The paramedic road can also lead to becoming a physician. This was a particular path that I took. 10 years as a career firefighter paramedic, I then decided that there has to be more. I asked myself the question, is this all there is? Is there nothing more? And I became much more interested in medicine. Subsequently, after receiving a bachelor's degree and fulfilling some prerequisites, I transitioned from paramedic to medical school directly. And this is the path that many in the EMS have taken. Fewer so are those of us who are actually professional firefighters prior to entering medical school. However, whatever path that you take, it can all lead to whatever career path you want it to lead to. There are no barriers except what's within you. You have to make the decision. Do I want to be a paramedic, a registered nurse, an advanced nurse practitioner, a physician assistant, or a physician? Now, let's say that you decide that you just want to be in the paramedical field, but you want to take that career path forward. Well, 911 systems have an organizational hierarchy which involves EMS chiefs, field supervisors, and educators. The paramedic can transition into a college or into a teaching paramedical program that will allow them to share their knowledge and to master others' techniques into becoming a functional field paramedic. Now, this is very rewarding from an education standpoint in that the paramedic need not spend his entire career in the field running EMS calls. There are plenty of paramedics who have transitioned into the college environment and as a result have become fairly successful teachers, insofar as they also become program coordinators and program directors. There are some who have transitioned with a bachelor's degree and the master's degree and the other educational achievements that they've had into deans of particular schools or provosts in particular schools as well. So one need not stop at just the paramedic level. Transition in education is very, very rewarding. Now, the paramedic can also join the military. In the military, in the Army, Air Force, or Navy, you'll find that many of these good people transition into medic positions. And as a result, they become flight medics, combat medics, tactical combat medics, and of course, aeroflight, aircraft medics. Now, this is a very narrow career path, but it is one that's available. If you're the type of paramedic that seeks excitement and challenges within a combat environment or a military environment, then this is something for you. However, that not everybody is cut out to become a military member and a paramedic to function as a medic in a combat situation. However, there are plenty of other positions within the military that utilize paramedics. For instance, combat surgical hospitals, Air Force theater hospitals. So again, the military even offers a great benefit for those who are licensed and trained in paramedics. One of the other areas that paramedics can transition to is what we call the community health paramedic. Now, this is a unique and a brand new area of paramedicine. The community paramedic actually goes out to the homes of patients who have been discharged from the hospitals and require home health care. Now, this differs slightly from home health care services that are provided by professionally trained nurses and paramedics belonging to a home health care agency. The home health care paramedic or the community paramedic, as part of a fire department or an EMS agency, contracts with the hospital to see the patients that were discharged from the hospital to their homes. Through telemetry medicine, the paramedics go to the home 2 days to 1 week after their discharge and provide higher levels of care. They'll bring in with them not only EKG machines and blood draw tubes, but they'll also bring in laboratory testing equipment. And they are trained to the level to interpret arterial blood gases, complete blood counts, comprehensive metabolic panels, liver panels, coagulation profiles, urinalysis. And then by telemetry, they will contact the physician if there's further care that's needed. The community health paramedic is a very well-trained paramedic that easily bridges into registered nurse. However, for the paramedic that does not want to become a registered nurse but wants to stay within the confines and the career opportunities that are offered within a fire department or an EMS agency, the community health paramedic provides a traditional 8 to 5, Monday through Friday position that is a career enhancement, as well as providing the security of employment within the municipal agencies. So from various standpoints, there are many different directions a paramedic can take. Now, if you come out of a foreign school, foreign from the standpoint of the United States, we will look at your transcripts. We will decide what is applicable and what you can get credit for in the advanced emergency medical technician portion, and what you can also get credit for in the paramedic portion of the training. So it does not necessarily mean that you have to go through the whole 9 months to 18 months, depending on the college that's offering the paramedic program. There are many opportunities here to have credit given for the education that you've received. Many instances, those that come from different bachelor's degree programs or even medical programs in a foreign country can have much of that applied, up to 50% credit applied to the programs. Subsequently, that shortens the length of time that you would be in training to become a paramedic. And then once again, once you're a paramedic, you have 5 different paths that you can take to enhance your career or to develop career opportunities on your own. One of the more popular ways that many healthcare professionals are taking right now are those within our chiropractic community. Doctors of chiropractic medicine have also elected to move forward as licensed paramedics. Subsequently, it enhances their opportunities within their own office settings and able to provide more holistic medicine to the patient, but it also helps them recognize as well when a patient is actually having more than just a chiropractic issue. When that chiropractor is completed with their training, they also have the opportunity to work within the healthcare provider paradigm in certain states and can actually communicate with the physician as to what the needs are for that particular patient, period. This not only affords them a different career opportunity path, but it may also provide them a different revenue stream as well. So, in summary, the paramedic can go from 911 response to registered nurse, mid-level provider, advanced nurse practitioner, physician assistant, community health educator, and of course an educator and manager. And then finally, in certain circumstances, the paramedic can also lead to becoming a physician. So whatever career path that you choose, just know that the basic foundation of all of this is becoming a licensed paramedic. I hope that this brief summary and orientation to paramedicine has benefited you. If you have any questions or comments, please do not hesitate to ask. All the contact information will be provided to you at the end of this video. Thank you for your time.